And we've been hearing plenty today about Cumbria's workforces in the NHS. And, you know, this morning, we are looking at the state of the NHS in terms of the winter rush. It is always peak season, isn't it, the winter for the NHS. They have a customer base in Carlisle of up to 40,000 people. It employs in the Carlisle area across 3 sites 186 folk. And this morning we are at Carlisle Healthcare. It runs GP practices on Eden Street at St Paul's in the city, and also at a new healthcare centre in Harrowby. John Bowness is spending the morning there for us as the doctors, the nurses, the other healthcare workers come into work and prepare for winter, which, as we've been saying, is their busiest time of the year. John, good morning. How busy so far is it looking this morning?
Well, it's starting to get busier, Mike, but it's not a traditional doctor's surgery where there's a kind of a big buzz. It's kind of where people come in, people distribute around the building, and so I'm in a room that's kind of tucked around the side, rather, because there isn't really somewhere with, you know, a buzz and lots of noise going on, because that's kind of not the way healthcare is run here. But to hear more about it, and with Dr. Robert Westgate, who's a GP and also clinical director at Carlisle Healthcare, we'll just touch on for a moment, because we didn't quite have time when I spoke to you almost an hour ago. Winter pressures in general. I mean, how ready do you feel you are here for the pressure that always builds up in the NHS every winter?
Yes, thanks, John. Providing a service is really challenging. It's really challenging. And as we mentioned earlier, demand outstrips supply, which is where the triage model comes in to try and make the best offer with what we've got. Winter pressures, it's mainly respiratory illnesses. So we see about a 10% increase in activity throughout the winter months, sort of coughs, colds, flu, etc., respiratory infections. So we need to plan for that with our workforce. There is some additional investment that the NHS provide into primary care in different pockets of need across the patch to allow us to increase capacity to respond to those respiratory illnesses. And we're just starting off with that this next couple of weeks to put a bit of extra in the system to accommodate for those surges.
We were just chatting a moment ago, before we came on air, about a fairly astonishing stat, well, I thought so, about the numbers of people who need a doctor on any given day.
Yeah, I mean, the headline is people can't get into their GP practice, and I recognise the access issues, recognise the challenges, and we can't offer what we want. But when you look at the numbers, about 1 in 52% of our population have contact with their general practice in England on a daily basis, which is pretty phenomenal. And that's a whole variety of different contacts. It's online, it's telephone, it's face-to-face, it's planned care, it's urgent care, etc. But yeah, 1 in 50 people have contact with a GP practice.
That's really surprising. Have you got any handle yet on sort of how busy things are starting to get here?
Well, it's panning out to be a fairly normal Tuesday, and because we look after a large percentage of Carlisle, we see patterns emerging on a day-to-day basis, so we can predict by and large what's going to happen, recognising the surges. So this morning we've had about 150 by 9 o'clock, about 150 contacts from patients. 96 of those have come in online, 62 have come in over the phones. That was at 9 o'clock. We expect about 100 or so per hour for the first couple of hours of the day. Then it tails off as the day goes on. But we're accessible for walk-in, telephone or online till our core hours finish at 6:30 this evening. Our challenge is how to respond in a safe and timely manner to those requests. And that's where it gets really difficult in general practice, because we can't always offer what we would want to offer, but we need to be safe and need to balance all those risks.
Those are some big numbers, and you're obviously a big practice. Just talking some more numbers, at the moment you've got about 2,500 patients for each GP, or for each full-time equivalent GP. You say you'd like to reduce that. What are patients sort of missing out on now that you feel you could offer them if you had fewer patients per doctor? Or more doctors per patient?
Yeah, I mean, it's interesting to get that the right around. So, as you say, per whole-time equivalent doctor, we've got over 2,500 patients. What we're missing out on is the ability to deliver high-quality continuity of care. Now, that might sound a bit woolly, but continuity of care actually makes a big difference. When you can provide continuity of care, so that the family doctor, cradle to grave, as I think the health secretary said, bring back the family doctor. When you implement continuity of care, you actually see less utilisation of A&E, less utilisation of out of hours, a 20% reduction in all-cause mortality for the population. So continuity of care makes a difference, but to deliver continuity of care, you need the right amount of doctors per population, otherwise it becomes very fragmented and very, very challenging. I would like us to be around 1,600 patients per whole-time equivalent doctor. The BMA has a target by 2040 of 1,000 patients per whole-time equivalent doctor. I think that would be an absolute dream. Very, very ambitious. But to get there, requires training, recruitment, investment, retention, etc., etc.
Well, I was going to come on to that with recruitment in particular. The King's Fund says that the total number of GPs has increased year on year since 2020, driven by increasing numbers of GPs. But is GP recruitment a particular issue here in Cumbria?
It's a widespread issue across the NHS. In Cumbria, there have been challenges around recruiting to the GP training programme. I'm pleased to say the GP training programme is now fully subscribed. The people completing training are now qualifying as GPs. The challenge is that we've got people retiring at the end of their careers. We're just about breaking even with people starting their careers, but the funds in the system to employ the new GPs coming through aren't necessarily there to be able to build the workforce that we would like. We're in a bit of a place where there's a national negotiation starting around what the future of general practice looks like. And for me, we need to absolutely invest in people to get those numbers of GPs per 1,000 population at a place where we can deliver quality care.
And as with any big organisation, it comes down to people and money. I mean, the government does say that it's giving general medical services an extra £9.5 million in 2025 to 26. But just in general, going into another winter, how worried are you that you've got enough of a workforce that you'll feel you'll need to look after the patients that you have now?
I'm concerned that we can't provide the quality service that we would like because of the resources that we've currently got. I would say that general practice is largely fuelled by kindness, but constrained by its resources. So the difficult decisions we have to make is how do we provide capacity that we would expect to need for same-day contacts, etc., and how do we respond to people with maybe more ongoing, less urgent but very important complex needs, and trying to get the balance of that right. So we try to do the best we can with what we've got. We have to be safe. We have to allow our clinicians to work safely. We need to use the rest of the NHS wisely, but we can't work in an unsafe way, and we can't be everything to everybody all the time with what we've currently got.
OK, for now, Dr. Robert Westgate, thank you very much. I'll come back to you at various points this morning and also explore some other parts of the site here. But thank you for the moment. Mike, more from me sometime after 9:30. And at that point, I'm going to be in the on-site cafe.
Excellent. What a great place to be, JB. Nice one, John. BBC Radio Cumbria's John Bowness, the British Medical Association, effectively the union for GPs, says there are declining GP numbers, rising demand, struggles to recruit and retain staff, and knock-on effects for patients. The government says it's giving general medical services an extra £9.5 million in 2025-26.